toolbox, if you like, of measures that they could pull out in order to try and slow the rate of infections. That could be vaccine passports, that could be more mask wearing. I'm sure there'll be questions about that. I'm not sure at the moment that that's where the government wants to go yet, but certainly at this press conference, I have no doubt that the journalists there will be asking questions about what additional measures some of the scientific advisors think that there might be needed. Just to say who is going, it will be Jenny Harries, who is now the leader of the Health and Security Agency, Stephen Paris, who's the medical director of NHS England, and of course the Health Secretary Sajid Javid.
And Beth Marcos in here now, just coming past 5 o'clock, and it is the news hour, but much of the news hour will be taken up with this news conference with Sajid Javid. Beth Rigby is with me. We might have a bit of talking to do, because I gather they're running a little bit late.
They're running a bit late, yeah.
Well, they don't have a COVID news conference for weeks, and then they're a bit late when they do. But interesting what you were saying. Cases, you said 49,000, so above 40,000 then for, what is it, the 8th day in a row. But the government's point seems to be that, when it comes to hospitalisations and deaths, then the situation is pretty static at the moment, certainly, compared with last month.
Yes, look, the government is, I think, applying a wait-and-see or a watch-and-wait approach. A Number 10 spokesperson saying today we've set out our autumn and winter plan in terms of Plan A and Plan B, and we continue to look at the latest scientific data. There isn't any proposed plan for any further lockdowns. We are sticking to the autumn and winter plan we have set out. But it might be worth raising, too, something that Patrick Vallance, the chief scientific advisor, said when the government did set out that plan in September. He said at the time there was a simple series of recommendations which I've been pushing continuously and continue to do so. And this is the critical bit. The lesson is to go earlier than you think you want to, go a bit harder than you think you want to, and go a bit broader than you think you want to in terms of applying restrictions. I'm afraid that's a grim message, but that is what the evidence says. And what I think is beginning to emerge is that we have certainly medical practitioners. We had Matthew Taylor of the NHS Confederation this morning saying that the overall evidence is that we do need to act. So you have a group saying, look, we think we actually need to bring in some measures now, that we need to get more stringent in terms of trying to manage the virus. The government, as I said, I think adopting a wait-and-see approach, and their approach will be, let's get the most vulnerable people with those boosters, that third shot of vaccine, which they hope for the over 50s and the more vulnerable will keep them out of hospital, will keep them better protected in the winter, and those in the medical services, some scientific advisors perhaps worried about what they can see coming down the track and wanting to take some preemptive measures now, such as perhaps face mask wearing, or perhaps introducing that COVID vaccine status to get into gigs or football matches or, big events. So there's sort of, as I said, a toolbox of measures. It doesn't feel at the moment that the government want to start rolling them out, but I think pressure is growing to do so.
I mean, we can have a look, I think, at, to build on what you were saying about what Plan B is exactly. Just stay with us, Beth, and under Plan B, the public will be told clearly and urgently, it says, about the need to exercise caution to help control the virus, with face coverings, as Beth was saying, once again becoming a legal requirement in some settings. It would mean the work from home mandate could be reintroduced, and the government would also have the option to make COVID vaccine certificates mandatory in those scenarios that, or some of those scenarios that Beth was talking about. Well, earlier, the chief executive of the NHS Federation told Sky News that action must be taken immediately.
What's frustrating is that the government has said that it is the pressure on the health service that will be the determinant of whether or not they act. I speak to health leaders every day in every part of the service, ambulance services, mental health services, the acute sector. I haven't spoken to a single one who doesn't say that they are incredibly stretched. It's only going to get worse. So the government needs to it needs to act on its promise, and its promise is to try to protect the NHS from becoming overwhelmed, and that's where we need to act now in order to head off that. And if we don't, I'm afraid we will once again, and we have been here before, we will stumble into a crisis.
Right, that's the NHS Confederation. Let's listen to what Kwasi Kwarteng was saying earlier on Sky News.
The conversation about restrictions on travel, restrictions on, more lockdowns is completely unhelpful. I think we've had a huge job of work getting the vaccine rollout to the point that we could reopen the economy. That was the main thing we were focused on this year. That has worked. And what we want to do is manage the situation as it is. We don't want to go back into lockdown or into further restrictions.
Stephen Riker, who, as you know, is a member of SAGE, is advocating Plan C and saying that we can't rule out another lockdown.
No, I would rule that out.
Let's go back to Beth Rigby. So, I mean, it's interesting, isn't it? I assume politically they don't want to go anywhere near another lockdown.
No, it's very clear that they don't want to go near another lockdown. The economy is coming back. The furlough scheme is winding down, and the government really do want to get a front foot, look forward, and keep the economy reopening and try and allow people to live as normal lives as possible. But as I said, there is that series of measures that could be introduced, and in different countries they do it slightly differently. When I went over, for example, to New York with the Prime Minister for the United Nations General Assembly, you couldn't go into a coffee shop and get a coffee in New York, in the US, in New York, without showing your COVID vaccination certification. Now, the government do have these options that they can introduce, but they don't want to go there. But I was talking to a cabinet minister at the Tory party conference a few weeks ago, or a couple of weeks ago, and when I said, what's the biggest risk going into the winter, they replied it was COVID, because there was an unpredictability about how the virus might behave over the winter. There's uncertainty whether there might become a new strain of the variant, and it is quite unpredictable. At the moment, we have high case numbers, and we have quite stable hospital numbers. But that is all the data that the government will be looking at. Obviously, in Scotland, what you've seen is that there was a peak when children went back to school. It's beginning to drop off in infection rates. We've got half term coming up, so there's a little natural circuit breaker there in terms of the children all being off school for 10 days or away from each other for 10 days. But the government, as I said, it is a wait and see approach. But Kwasi Kwarteng sort of ruling out a lockdown completely there, it's obviously absolutely the last thing that the government would do. But I'm not sure the Prime Minister would emphatically be able to rule it out, because if you had, for example, a new variant and you're in a position that we were in December last year, it might not be as easy to just completely say no to doing that. But absolutely, that is something that the government would 100% not want to do.
And the real concern here is that still half, I'm just seeing, of 80-year-olds have not had this booster jab. So Downing Street saying today that vaccination and the rollout of vaccine had broken this link between cases and hospital admissions and deaths. But that relies now on the booster programme being stepped up, doesn't it?
Absolutely, and that's why I was saying at the beginning of talking about what they might talk about today, that Chris Whitty tweet talking about trying to get people to go and get those boosters, rolling out the booster, communicating that, pressing upon the public the need to go and get that extra protection if you're over 50, if you're in vulnerable age groups, is going to be critical going into the winter. And I'll be interested to hear what they say about that. Are they going to make it more readily available, roll it out to more places, have drop-in centres? Are they going to talk more about other antiviral drugs that the NHS is buying up in order to try and limit the effect of COVID if you get it? Because one of the great things of the vaccine, as we all know, is that even if you do get COVID, the chances of you having to go to hospital or becoming really ill are much lessened by having that double dose of the vaccine. So there will be a big public information push, I think, in the coming weeks to try and get people to get those boosters and also have that vaccination if they haven't. And in schools now, 12 to 15-year-olds, there's a big push to try and get the younger people vaccinated too.
And there's some more detail, Beth, just coming in on antiviral drugs that the government have acquired, and we're going to hear more of, I'm sure, more about, rather, from Sajid Javid. And Britain says that the government says it's secured 250,000 courses of Pfizer's oral antiviral COVID-19 drug, and the government says that the antivirals need authorisation from the medicine regulator, but could be in use by the end of this year. They've also bought 480,000 courses of another antiviral drug. So clearly that will be something that Sajid Javid will want to talk about.
Yeah, I've actually got that statement here. I'm just having a look at that. Yes, they're saying here that they've got 2 new antiviral drugs that they have bought up, and they're expected to be given to those most at risk of the virus. And the government's saying that that will help reduce the severity of symptoms and ease the pressure on the NHS over the winter. The Health Secretary, I think, will say in this press conference that this is a new defence in our arsenal with 2 new antiviral drugs that the government have secured. So again, another line of defence for the government, but it will not want to detract in this press conference about really trying to get elderly people to go and get that booster, because there are concerns that the effectiveness of that double dose vaccine begins to wear off. So what they really need is for the over 80s particularly, but everyone over 50 to go and get those boosters to give them that protection as we go into the winter.
Right, and they seem to be saying that the booster booster vaccine supply is not the problem. It's that more people have to come forward. And as I speak, Beth, Sajid Javid is about to begin.
Good afternoon and welcome to Downing Street for today's coronavirus briefing. I'm joined by Dr. Jenny Harries, the Chief Executive of the UK Health Security Agency, and by Professor Steve Powis, the Medical Director of NHS England. We've always known that the winter months would pose the greatest threat to our road to recovery. The darker skies, the colder weather provide perfect conditions, not just for COVID-19 to thrive, but for other seasonal viruses too, like flu and norovirus. And ahead of winter, just as we expected, we're starting to see this impact. Cases are rising, and yesterday we reported 43,738 new cases across the UK, up 16% from the previous week. And they could go yet as high as 100,000 a day. We're also seeing greater pressure on the NHS. Across the UK, we're now approaching 1,000 hospitalisations per day. The NHS is performing with distinction, and I'd like to thank everyone who's working so hard to keep us safe. And we'll do what it takes to make sure that this pressure doesn't become unsustainable and that we don't allow the NHS to become overwhelmed. Deaths remain mercifully low, but they are still, sadly, over 100 a day. This pandemic is not over. Thanks to the vaccination programme, yes, the link between cases and hospitalisations and deaths has significantly weakened, but it's not broken. So we must all remember that this virus will be with us for the long term and that it remains a threat to our loved ones and a threat to the progress that we've made in getting our nation closer to normal life. We're looking closely at the data, and we won't be implementing our Plan B of contingency measures at this point. But we'll be staying vigilant, preparing for all eventualities while strengthening our vital defences that can help us fight back against this virus. And today, as we approach this critical time for our nation's recovery, I wanted to bring you up to date with some of the work that we're doing to strengthen these defences as we learn to live with the virus. One line of defence is treatments, and I have some positive news to share today. We should all be proud that the UK has been at the forefront of some of the most cutting-edge treatments. COVID-19 treatments have already had an amazing impact, and they're especially important for people who can't take vaccine for medical reasons or if they are immunocompromised. It was British scientists who led the clinical trial that discovered dexamethasone that can be an effective treatment for COVID-19, and it's already estimated to have saved some 1 million lives across the world. And some of the most vulnerable NHS patients in hospital are already benefiting from Ronapreve, a treatment of monoclonal antibodies that was specifically designed to treat COVID-19. We're also seeing some promising developments around antivirals too. You see, antivirals work by targeting a virus at an early stage and disrupting the way the virus develops and multiplies. I'm pleased to announce that we have signed 2 landmark deals, securing hundreds of thousands of doses of 2 new antivirals from Pfizer and from Merck Sharp Dome. These antivirals have the potential to speed up recovery time and to stop infections from progressing. If these treatments get MHRA approval, then we can provide some of the most vulnerable patients with vital protection this summer. And I want to deploy them as quickly as possible. I'd like to thank everyone that's been involved in this, especially the Antivirals Task Force, under the leadership of Eddie Gray, for everything that they've done to make this happen. And we'll keep working to secure even more of these incredible treatments so that we can continue to protect as many people as possible. This is great news, but we cannot be complacent when COVID-19 remains such a potent threat. Ever since our phenomenal vaccine programme began last winter, we've been in a race between the vaccine and the virus. And although we're ahead in that race, the gap is narrowing. We've come so far, thanks to the efforts of so many, but with winter ahead, we can't blow it now. So we're going to do everything we can to maintain our lead by strengthening our vaccination programme as our primary line of defence. First, we'll redouble our efforts to encourage anyone who's eligible to take up the initial offer of a jab. There's almost 5 million people over the age of 16 that remain unvaccinated in the UK. It might be someone you know, a friend, a family member, a colleague. And if you do, tell them that it's never too late to come forward. So if you yet haven't had your jab, please take this huge step to protect yourself and to protect your loved ones. Second, we've extended the offer of a vaccine to more and more people, including young people aged between 12 and 15 years. And we'll be making it easier for them to get protected by opening up our national booking service so they can get their jab at our vaccination centres across the country as well as at school. Third, we've also started rolling out our booster programme, which is vital to keeping us safe over the coming months. Because although our vaccines offer powerful protection, we now know that the protection that you get from a COVID vaccine reduces materially over time, especially in older people who are at the greatest risk. And without delivering a top-up of protection through a booster dose, we will see a real-world impact. As well as this, COVID-19 mutates, like any virus, and we're identifying new variants all the time. This includes a new version of the Delta variant, which is currently known as AY 4.2, and that new variant is now spreading. And while there's no reason to believe at this point that AY 4.2 poses a greater threat, the next variant, or the one after that, might do. So we need to be ready for what lies around the corner. This means our ongoing programme of booster jabs is so important, and this winter we're prioritising those most in need. Today, we've reached a milestone of 4 million top-up jabs in England, but we need to get even more people protected. We've got the jabs. We just need the arms to put them in. If you're over 50 or in another priority group and had your second jab over 6 months ago, you're eligible for a booster, and the NHS will send you an invite. If you haven't been invited within a week of reaching that 6-month milestone, then please get onto the National Booking Service and book online or phone 119. Not just to save lives, but to keep your freedoms too. Because all of these precious moments that we've been able to restore over the past few months, the loved ones that we've been able to see, and the collective experiences that we've been able to share, they've been possible thanks to our vaccination programme and because of so many of you that came forward when it was your time. And if we want to secure these freedoms for the long term, then the best thing that we can do is come forward once again when that moment comes. After the decisive steps that we've taken this year, none of us want to go backwards now. So we must all play our part in this national mission and think about what we can do to make a difference. That means getting the jab when the time comes, whether it's for COVID-19 or flu. But although vaccinations are our primary form of defence, there are many more things that we can all do to help contain the spread of this virus. Like, meeting outdoors where it's possible. And if you can only meet indoors, letting in fresh air. Like wearing a face covering in crowded and enclosed spaces, especially if you're coming into contact with people that you don't normally meet. And like making and taking rapid tests, making them as part of your weekly routine. 1/4 of the positive cases that we are now identifying come from those lateral flow tests that people are taking without symptoms, but they're taking them as a precaution, especially if they're about to go and meet a loved one, perhaps a grandparent or another vulnerable person. With winter soon upon us, these little steps make a big difference. And they're more important now than they have ever been. If we all play our part, then we can give ourselves the best possible chance in this race, get through this winter, and enjoy Christmas with our loved ones. Thank you. I'd now like to hand over to Jenny, who will take us through some of the latest COVID-19 data. Thank you.
Thank you, Secretary of State. Could I have the first slide, please? So I think what I'm going to do is just highlight where we are in the epidemiological picture today, but also highlight some of those successes from the vaccination, but also some of the risks that lay ahead of us this winter. And the first slide is showing us the number of individuals who've had at least one positive COVID-19 test result. This is right across the UK and brings us up to the 20th of October. And what we can see there is that since yesterday, we have had 49,139 people tested positive. Now, the number here, the 45,799, is our average through the week, which is entirely appropriate. We get dips and peaks. But if I just go back 1 week to the 13th of October, the number then was 42,776. So what you will see is there's quite a steep increase as we go forward in the number of cases. And I'd just like to flag on this, the unusual and slightly worrying picture of the shape of that curve. What we can see is that the cases now are almost as high as they were in July and actually not far off where they were last winter. What we are not seeing is that dip down again at the other side of the peak, and that is really important because we are kicking off the winter at a really high level of cases. Fortunately, that is not currently working through into serious disease and deaths, but we will come on to that in a moment. So could I have the next slide, please? So this slide shows the number of people in hospital with COVID-19, again, right across the UK. And this has increased by 10.3% since last week. So again, we are seeing that movement forward. We would expect a high point after rising cases to come about 2 weeks after a peak. And again, if you look at the bottom on the right-hand side, you can see where the cases peaked previously in July, in middle of August, you can see that there's a peak there. Again, what hasn't happened is those cases have not decreased. They've continued at a fairly high level. And in actual fact, in the last few days, they are continuing to increase. So we had 7,891 people in hospital on the 19th of October. Again, if we go back a week, only just over 7,057. So again, a steady increase at the moment, and this is as we approach the winter months. And if we just compare, if we go back to hospital in January, the peak then was around 39,200. So we can see we're a long way off that, but it's a very different epidemiological picture. Next slide, please. And then, sadly, we look at the deaths. So we know that there was a very high death toll in the first wave of the pandemic, and the total deaths, which we've sadly recorded since the start of the pandemic, are now just over 139,000. And these relate to people who've had a positive COVID test within 28 days of death. Again, what we can see here is the most recent 7-day average is 136 deaths. It's very flat compared with the first wave, but it's clearly every life is of significance. And I think one of the more significant points about this is we have had, in the last 2 days, the highest rates we've had for some time. So just in the last 24 hours, 179 deaths recorded. So again, these are moving in the wrong direction. We can see the effect, the really strong effect of vaccination, which it's difficult to believe just wasn't here this time last year, but still moving in the wrong direction. Next slide, please. And then this is why we see that difference. We have had a huge rollout of vaccination. This chart shows the cumulative uptake of individuals who've received their first dose, that's in blue, and then who've received 2 doses, that's in orange. And in total, over 49.5 million individuals have received that first dose, and over 45 million the second. So we now have in the 12-plus age group, right the way through adulthood, 86.1% of our population have had that first dose, and 79% the second dose. But clearly, from the information that we've had before, the fact that we're now approaching winter, and the fact, as the Secretary of State has said, there are still people out there who have not had a first dose, which will significantly protect them. There's still plenty of opportunity to come and get that. And if we look on the next slide, which shows us how the booster vaccination programme is going. So these are the vulnerable groups, that's the elderly, individuals in care homes, those with underlying conditions. And you can see here that we have reached over 4 million individuals having their booster dose. And I know Professor Powis can add some detail to that as we go forward. Now, this is for England only data, and it's increased from 860,000 on the 30th of September. So that is rolling out very rapidly now as we move forward to cover all of those at higher risk. And then on the final slide, I just want to highlight how important that vaccination is. What we can see here are COVID-19 cases coming into emergency care within 28 days of a positive test. And these are individuals where that hospital interventions resulted in an inpatient admission. So these are people who have had to seek care. And what you can see is, in terms of vaccination status, the dark blue lines are those individuals who are unvaccinated, and the orange lines are those people who have had 2 doses. And I think it's clear that as you get more elderly, you have a number of other conditions, but even then, the protection that is afforded to the older people is significant. But for younger people, I think there is a really important message here, which is you have very, very little risk if you have 2 doses of vaccine, but you have a significant risk if you have had none. And at that point, I'll hand back to the Secretary of State.
Thank you very much, Jenny. So we're now going to take some questions, and the first 2 questions are from members of the public, and I believe the first one is from Ruth, who is in Cornwall. So I just read the question out. With the huge rise in COVID infections, would it not be sensible to make wearing face coverings mandatory in public buildings again? So if I start to answer that we've set out a clear plan a few weeks ago when we took the Step 4 decision back in July, and we still feel absolutely it's the right decision to start to learn to live with this virus. And a lot of mandatory measures then were put into guidance. And it's asking people to take more responsibility, to follow that guidance. And when it comes to face coverings, as I've just said a few minutes ago, is that everyone should follow that guidance and think about others around them and in the settings. And if they are in a closed space, especially with people that they are not normally with, then they should wear a face mask. If they're on public transport, London Underground, for example, which has a face mask rule, they should observe those rules. And then just finally, to say to Ruth that we have also said that if we need to take further measures as part of our contingency plans, Plan B, they would include making face masks mandatory in certain settings, and that may well include public buildings. If I can, then the next question is, I believe, from Jonathan from Leicester. The question is, many children, 11 to 16 years, have contracted and recovered from COVID prior to their offer of a vaccination. What is the government going to do to provide them and their families with proof of recovery so that they can travel abroad for the forthcoming half-term break? So what I would say to Jonathan is that, first, in many countries, not all, but in many countries where they have a vaccination rule for entry, or even for if it's travel by plane for when you're prior to boarding, that they would treat anyone under the age of 16 or under as being fully vaccinated, as the UK does. That doesn't apply, as Jonathan, I think, is also alluding to every single country. So we are working on a plan that would allow from our end to give some kind of proof of antibodies, but it will ultimately be up to the country that child with his or her family is travelling to decide whether they can accept that. And it is something that, as we've done with vaccinations, we work with our international partners to try to come to a common understanding. My thanks to Ruth and Jonathan for their questions. Now from the journalists, thank you all for coming. And the first person that I've got on the list is Sophie from BBC News.
It's a question for the Secretary of State. NHS organisations have said today they are right at the edge of what they can manage now. And given that your own measure is unsustainable pressure on the NHS in order to bring in restrictions, isn't it time to do so? Also a question for Professor Powys. Do you believe these NHS organisations when they say they are right at the edge? Is this not unsustainable pressure?
Thanks, Sophie. Let me start to answer that. First of all, I think you're referring to the NHS Confederation. I've got a lot of time for the NHS Confederation. I've met with them in the past, and I will do in the future, and they do a lot of good work. On this particular question, we don't believe that the pressures that are currently faced by the NHS are unsustainable. Don't get me wrong, there are huge pressures, especially in A&E, in primary care, for example, as well. But at this point, we don't believe they're unsustainable. And Steve can answer a bit more about that in a moment. But I will say one of the reasons I think the NHS is able to do what it does still. Number one is obviously thanks to everyone that's working in the NHS, but the extra support we're providing this year, for the second half of this year, we're providing an additional £5.4 billion, which is certainly helping, and that's what we hear, and we will absolutely keep it under review. If we feel at any point it's becoming unsustainable, then the department, together with our friends at the NHS, we won't hesitate to act. Steve.
Yes, thank you, Sophie. So I think the first thing to acknowledge, as the Secretary of State has said, and indeed as our Chief Executive, Amanda Pritchard, said at the Health Select Committee yesterday, the NHS is under considerable pressure. We've had a very tough summer as we have continued to treat people with COVID being admitted to hospitals. As society has opened up again and we've begun to see a return to normal, near normal levels of presentations of urgent and emergent people who need urgent and emergency care. And of course, as we started to make inroads into treatments for patients whose care has been disrupted and delayed during the pandemic. So it undoubtedly feels exceptionally busy in the NHS, and our NHS organisations are telling us that all the time. Now, in September, we saw a reduction in the number of COVID patients in hospital, down to below 5,000 in England, as infection rates went down, as Jenny showed you earlier. In the last few weeks, those infection rates have gone back up again. And we have started to see, again, as Secretary of State has said, an increase in the number of admissions and an increase in the number of patients in hospital. So now in England, in our main hospitals, we're just over 6,000, as I stand here today, 6,000 patients with COVID, which is back to where we were in the middle of September. And I anticipate that over the next week or two, that number will increase because infection rates are increasing. And as I've said many times, there is a lag between infection rates and hospital admissions. Now, it's not just COVID, of course. We have one eye to the flu season. And we don't know what's going to happen with flu this year, but there is a risk that we will get more flu back and it will be worse than previous years because we missed out a season last year. And there are other viruses around as yet as well. And of course, we are continuing to do all that work around the recovery of our elective and routine services. So it is very, very busy indeed. We work very closely with the Department of Health Social Care around the judgment of how the NHS is doing, and we will continue to do that as we go into winter. But I think the really critical thing is that the public can help us here. The public can absolutely help the NHS here. And as the Secretary of State has said, there are things that the public can do that will take the pressure off the NHS. So the first is to remember that for face masks, there is guidance in place. If you are in a crowded environment, a higher risk environment, on the tube, a building, cramped building with low ventilation, then wear that face mask. It makes a difference. It really does. And the second thing, of course, is the vaccine programme, because the vaccine programme is our best protection against COVID. And therefore, if you've been invited for a booster and you haven't had one, or if you are getting your invitation in the next few weeks, then get that booster as quickly as possible, because we know that the immunity that we get from vaccines will drop off over time. And we don't want that to occur going into winter. So this is not something that we just need to leave. We can get the public to help us on this. And during the last 18 months of the pandemic, I think the public has been fantastic in responding to assist us in the NHS with pressures. And the public can do it again by remembering COVID is still here. We need to be cautious where appropriate, and we need to get those jabs when we're offered them.
Thank you, Steve. Next, Romilly from ITV.
Secretary of State, new cases today are only just under 50,000. You just said yourself they could go as high as 100,000 a day. Aren't you in danger of ignoring the main lesson from the pandemic so far, which is if you ignore the warning signs when they're flashing and you don't take action, then you have to take harsher action further down the line? And to Professor Powis, if I may, are you concerned about waning vaccine immunity, and are you already seeing an increase in the number of double-jabbed people being hospitalised?
Thank you. I think that the plan that we've set out is taking absolutely into account the situation we're confronted with at the moment. And in my remarks, the entire focus is on what we can do to help ourselves Obviously, the government's got a huge role to play, the vaccine programme, the testing programme, but we need people to take up those vaccines when they're offered, especially the boosters. And the testing regime and that stays in place, the offer of free tests, for example, as I was saying, that is so important, identifying positive cases, the action then people take if they are positive to isolate and not spread that virus any further, and the behaviours that we've talked about that we can all deploy. And we've set out that's our sort of plan A, what we've called plan A. We do have contingency measures ready. I won't go through them all now, but they're publicly available. And we've set out what we would do if the situation became more challenging. And so we're not at that point yet. And what I hope is that everyone can play their part, especially when it comes to the vaccinations, especially when it comes to the booster. If you are invited or if you're at that 6-month milestone, please get your boost.
Well, I think we're all concerned about waning of immunity, but I think the first thing to say is to remind everybody that vaccines are incredibly effective. If you wind back a year ago, I think if you had said that we would have a vaccine programme rolled out to as many people as we had, which has a 95% or thereabouts effectiveness at preventing hospital admission, I think we would have been absolutely delighted. So don't forget that vaccines are incredibly effective and are giving a high level of protection, and that is why for similar infection rates, we are not seeing the numbers of people in hospital that we saw in previous peaks. But it's a natural phenomenon that immunity reduces over time after a vaccine, after a natural infection. That's why people get repeated flu infections over the course of their lifetime. So this is a natural phenomenon. It will occur. And that's exactly why JCVI have recommended that a booster dose is an important part of our armament against this virus in boosting immunity, particularly as we go into this winter. So, yes, waning of immunity will occur, but we have a way of dealing with that, and that is the booster programme. And therefore, once again, to remind everybody that getting that booster when you are offered it, and when you're eligible 6 months after your second dose, is really critical. This pandemic is not over yet. Increasing the level of immunity that we have in the population by that booster is one of our main defences going into the winter, along with the caution that we've described in terms of people being sensible, particularly in higher risk environments. And then the final thing I should have said earlier, I'll say now, is don't forget your flu vaccine. Because I said, flu is likely to come back this winter. Last year, we had our most successful ever flu vaccine programme in the NHS. We didn't have any flu. This year, it needs to be even better. So, jab for COVID, jab for flu. Be cautious. That's our message going into winter.
Thank you. Next, Thomas from Sky.
Secretary of State, some people may see it as complacent that you see nothing in the data at the moment to give you any cause for concern, particularly when you've got people like the NHS Confederation and many senior scientists arguing that all the warning signs are there. Give us a number. How bad do hospital admissions need to get per day before you do bring in Plan B? And can I ask you a question also on the antivirals? There will be many people who, with weakened immune systems now, who are very concerned about the surge, hopeful that these drugs might be there for them. Will they be?
The first part of your question, that we are concerned. I think everyone is right to be concerned, and I hope that I've managed to, just in the last sort of 10 minutes, express that concern that we have and the reasons why we do, with the cases rising, as Jenny has just shown in some of the latest data as well. Deaths, as I said, are still mostly low, but they're still more than 100. And the focus, though, very much remains on what we set out in Plan A. Those vaccines that they are working. They are, as Steve has just alluded to, we've seen from the data, if you look at the hospital admissions as well, the vaccines are clearly working. We estimate, the ONS estimates that they've saved some 130,000 lives. They've prevented some 240,000 people from being hospitalised. They've prevented some 24 million infections. That's what the vaccines are doing. So if more people get vaccinated, including, by the way, just to emphasise again, the 5 million or so across the UK that haven't even had their first jab, And that's why I said, if you know someone, please appeal to them, speak to your friends, your relatives, and just really sort of nudge them and say, please, do your bit to help yourself and help others. And if they've got some weird ideas about vaccines because they've been reading misinformation on the internet or elsewhere, then point them in the right direction. But the vaccines are absolutely key. And as Steve has also said, the flu vaccine this year is more important than ever. It's our biggest flu vaccination programme in history. I think some 35 million doses that we've got, and the people together that we're targeting with that to really help combat both those viruses. So that's our plan. We remain cautious, and and you asked me what's the number of hospitalisations that we monitor this daily. We work very carefully, obviously, the department with the NHS on a daily basis, and it's not just one particular number that we're looking at. And I'm very conscious that behind these numbers, you often talk about numbers easily, but there's a person, there's an individual, there's a family that's being affected. We're very conscious of that. But as well as hospitalisations, we're looking at the pressure on the NHS across the board, on A&E, on primary care, on emergency services such as others, like 999, the ambulance services. So we're looking at a number of factors and taking them all into account. On the drugs, the new antivirals, I can tell you a bit more about them. But in terms of the total that we've put, is 730,000 courses, patient courses we've purchased. That's 480,000 courses of the Merck that I referred to, and then 250,000 from Pfizer. It's important also, I think, to state they work differently. They're different mechanisms. So it could be one or the other that might be deployed. In some cases, it might be both. They're both oral, and they can be deployed either if someone has fallen ill, or if from COVID, or if you expect that they might do because there's an outbreak, let's say in a care home, where you would naturally have vulnerable people. It's a really new sort of fresh tool in our armour. These are the first antivirals ever that are designed specifically for COVID. They still need to get approval from the MHRA. The tests that are publicly available at the moment have been very encouraging, but we wanted to get there in early and sign a deal so that we can be one of the first countries in the world to receive them should they be approved by our regulator as safe and effective. Steve, did you want to add to that?
Yes, well, I think as the Secretary of State has said, there is no one number that we would use to think about triggering further interventions, because it is more complex than that. There is a variety of things that we look at. So we talked about infection rates, because they tell us what's likely to happen in the NHS in the next few weeks. We've talked about vaccine effectiveness, because that tells us how many people are likely to require hospitalisation. We look at, obviously, the number of admissions, but we also look at what's happening with flu and other viruses and what's happening with other emergency admissions. So there's a variety of things that we will be looking at and continue to look at. And, of course, the final thing to say is that we do see geographical variation. So what's happening in one part of the country might not be happening in another part of the country. That's been typical of the pandemic over the last 18 months. And it's possible that we will see that variation again. So there is no one number to look at. We have to look at things in the round, look at all these numbers, use judgment, and, of course, work closely with colleagues in UKHSA on the public health side, Department of Health and Social Care, to take a collective judgment. And on the antivirals, it is indeed great news. As the Secretary of State has said, over the last 18 months, I think one of the things that has been most impressive about the response of the NHS, its ability to stand up drugs rapidly, to investigate drugs, and to work out which drugs are truly effective at managing this pandemic. And that has undoubtedly saved many lives in the UK, but actually throughout the world. And I think we should be really proud that a public health system, healthcare system such as ours is very well placed to do that sort of study, and we've shown that we can do it. So we have these new antivirals coming on stream. Molnupiravir is likely to be the first one. In terms of who should get it, clearly that is a little bit dependent on the MHRA, who need to license it, and they will license it with their particular licensing conditions. We will, of course, be taking advice from clinical experts as to who it is most appropriate. But in general, we would want to target these drugs, as we have done in the past, at those at the highest risk of infection and the highest risk of hospitalisation, because that is what we are most trying to avoid, and of course death. And so, yes, I think it is likely that individuals with weakened immune systems are likely to be on that list that our clinical experts would recommend. But let's wait until we get the MHRA licensing, and let's wait until we get the advice of our clinical experts.
Thanks, Steve. Kate from The Sun.
Secretary of State, you'll have seen today that the Sun's launched a new campaign to urge Brits to get their booster jabs. I wondered, do you want to see a sort of return to that blitz spirit we saw in the first vaccine programme, when people were proud to get their jab, posting pictures of it? And more concretely, are we going to see a return to things like pop-up clinics, maybe a dad's army of retired medics, enlist the military to sort of help us turbocharge that jabs rollout? And to the medics, some GPs are saying they're too busy to roll out the booster jabs. This is just not a high enough priority. Are they wrong? And what would you say to them today?
Thanks, Kate. Yes, in short, yes. And thanks to The Sun for its campaign, and others that are getting behind this, that the boosters, they really could not be more important. As I've said, that we've just, as a country, we've come such a long way. We've got so much to be proud of. The scientists that designed the vaccines, the NHS and all the volunteers that delivered the vaccines, and look where it's got us. Look where we are today versus just not even a year ago, the start of this year. Look how it's changed our daily lives. And we all want to keep that. We want to sustain that. And the biggest difference is the vaccines. And it cannot be stressed enough how important it is to first get your initial vaccine if you're one of the 5 million that haven't. But if you are the millions that did, the 95 million jabs that we gave, if you're one of the recipients of those that, we know your immunity wanes. We're particularly concerned about those over the age of 50, and it's been 6 months since their second jab. And they really need to get the boost. And it's great that so many people are coming forward, but we need more and more people to come forward as their 6-month milestone comes together. And yes, we will be, as well, obviously it's in the vaccination centres, it's GPs that are going out there and delivering them in care homes and other places. They're making home visits for those that need it. There will be the pop-up centres, vaccination centres, the mobile units. We're going to deploy everything, and it is, and I think you used the phrase, is it a blitz spirit? It is. We need to sustain the progress that we've made. We could lose it. We really could lose that progress if people don't take up their vaccination offers. And I really couldn't emphasise it more. If I may just say this again, it's important to flu. If you're eligible for the flu vaccine this year, we expect there to be a lot more flu around than normal. Why? Because last year there just wasn't much because of the measures we'd taken over COVID. There wasn't much circulating. And also there weren't the usual number of samples to make the flu vaccine. And so you take that together, your flu could be a real problem this winter, but we can all do something about that. That's the good news, and that is get your flu vaccine.
Yeah, so as I've said, I think the public has responded magnificently over the 18 months of the pandemic in responding to the interventions that needed to put in place, and they were incredibly painful, but the public stuck to them. And of course, coming forward in droves to get their jabs and vaccines in the initial stages of the vaccine programme. I think the important message is that the booster is not some sort of add-on. It's a really critical part of maintaining immunity. And if we don't maintain that level of immunity, then yes, we will see infections translate into more hospital admissions and more pressure, unfortunately more deaths. So society has opened up, and that's great news, but people shouldn't get complacent and shouldn't forget that there's still a pandemic there, and that public spiritedness of coming forward and doing your bit for society, I think, Absolutely, we need that spirit. On GPs, are extremely busy as society works up again. They've played an absolutely fantastic role in the vaccine programme, and they will continue to do so. But of course, our strategy throughout has been to ensure that there are as many routes as possible to get a vaccine. So we've expanded the community pharmacy programme, so you get it through your community pharmacy. We have put in place vaccination centres. We've had pop-ups, as you've said. And what we've learned through the initial stage of the vaccine programme and carrying that onto the booster programme is for many people, having a vaccine centre which is close to them is really important. And so we have worked with local communities, with local government, with local public health officials to really identify where it is to best place those vaccine centres so that people can access them easily. And we will continue to do that because that, we know, combined with that public spiritedness, is the way to get as many people vaccinated as possible.
Perhaps if I can
Jenny, please.
Just add to that. So absolutely a huge thank you to GPs, but not just GPs, actually, it's primary care and all the other volunteers that have come in to do vaccinations through the pandemic. I just wanted to sort of add perhaps some clarity, because I think from a public perspective, the idea of waning and then promoting a vaccine can sound a little counterintuitive. So just to be really clear, the evidence to date shows that the vaccines, all three vaccines that we've been using, are around 90% effective in preventing deaths, up to 5 months. We know that, and obviously JCVI will continue to monitor that, and we publish regularly on it. So I think it's a really important message out there, but exactly as Professor Powers has said, we need to maintain that level of vaccination as we go forward. That's an important one. The second point is, though, that vaccination is really good at preventing serious illness, hospitalisations and deaths. It is not necessarily preventing you getting infection. And this is quite important, because one of the key messages here is both about vaccinations, whether it be flu or COVID, but actually our rate, the reproduction rate, is hovering somewhere between 0.9 and 1.1. Now, when it's sitting over 1, those rates will continue upwards. If we just tip it the other way, it will start coming downwards. So actually, quite small behavioural changes in all of us would bring that down. So there's a message also to those who are vaccinated. Don't think not to wear a face covering. Put a face covering on. You may be carrying an infection with you and not know. It's really important. We've got a natural break, if you like, coming up ahead with half term. Children have largely had infection. And so if people adopt those behaviours and we keep the vaccination rates up and children are going forward to get their vaccinations as well over the half term, then I think that our rate we can all tip it down under 1.
Thank you, Jenny. Chris from The Times.
Yes, I mean, Secretary of State, you said you've painted a pretty gloomy picture of winter, and you've highlighted some specific things we can do, like getting our booster jabs, wearing face masks, getting tested. Should we be changing our behaviour in any other way? I mean, people are socialising, they're going to the office, they're going to parties, some are apparently planning Christmas parties. Should we carry on with all of that, or should we be having some second thoughts? And to Professor Powys, we're getting a lot of complaints that people who want to have their booster campaigns, they're eligible, they're 6 months on, but they haven't heard anything from the National Booking Service, they can't book in online. Are you saying today that you're going to change that system so that people can book in automatically online once they're eligible without having to wait to be asked?
Thanks, Chris. We are heading back towards normal. We're a lot closer to normal than we were just a few months ago, but life isn't back to normal. I think everyone can see that because the pandemic is still there. It's here in our country, it's around the world, in other countries, it's where they don't have, sadly, the benefit of the vaccines, for example, like we do. It's a much, much bigger challenge. And I think people can see that. And so when they are planning and going about their daily lives, there are things that we can all do. I mean, of course, there are no restrictions anymore, and great on whether it's having a party or a wedding or going to church or a mosque or something. There's none of the restrictions that we had before, but there are all precautions that we can take, and we've talked about some of them again today, about whether it's face masks if it's enclosed and with unfamiliar people, being outdoors when you can, and of course that's harder in the winter, and that's why we're worried about the winter, because it is darker outside earlier, it is colder, and so there's less time outdoors, and you want to spend more indoors. So take that into account and see what you can do. The big thing that I think everyone can do more of is really take advantage of that offer of a free lateral flow test. because where we've seen that people are, if they're going to a party, perhaps it has relatives that are elderly or grandparents, someone who's immunocompromised, then it's really important that you take a lateral flow test. They're there not because you've got symptoms, because you're taking a precaution, and you take that, and that makes that party and what you're doing. You can still go ahead with it, but it just makes it a lot safer. So there are really a lot of things that we can do, and if we want to keep and hold on to the fantastic progress we've made, then we've all got our role to play.
I think one of the things that we've all learned during the pandemic is to be a little bit more cautious when we're not feeling well, and we might have an infectious disease that we could pass on. Yeah. And so I think, there's a sort of stoic British attitude that you carry on regardless. You go into work even if you've got a cold or a sniffle. But I think what we've all learned is in doing that we can spread disease. So I think there are simple things that we can do, which is just, if you're feeling a bit, unwell, it feels like you've got a virus, whether it's COVID, or obviously when it's COVID, you need to isolate. But if it's not, maybe think cautiously about the risk of spreading it on. And of course, hand washing. Hand washing is a very simple, effective measure for COVID, but for other infectious diseases. So I think coming out of this pandemic, people are more cautious and understand the risk of spreading infectious disease more. And I, for one, hope that we will carry on those behaviours. On the vaccine and the booster rollout, so if I give you the breakdown of the figures, eligibility, the numbers eligible change every day, of course, as more people come into that eligibility criteria. But roughly around 8 million people have become eligible, of which, as you've heard, 4 million have been jabbed to date with their boosters. There's around a couple of million who are being invited this week, so we'll hopefully be coming forward in the next few weeks. And there's about 500,000, 500,000 who we go to directly, such as residents of care homes who don't get invited in through those systems. So that leaves about 1.5 million who have been invited. Some of them might have been invited very recently who still need to come forward. So for those people who've had the invite already and haven't come forward, please do come forward. We have the capacity. As the Secretary of State says, we've got the jabs. We need your arms to put the jabs into. And of course, for those who are coming forward, who are getting their invites this week and in weeks to come, don't delay. And to make it easier, as the Secretary of State said, if a week after you become eligible, you haven't heard from us, then you can go onto the national booking system and you can book yourself. And that's exactly what we did, if you remember, during the initial rollout, where we targeted people by invitation, but then we offered the national booking system out to people so they could book directly, so that for those that, for whatever reason, haven't heard, have the opportunity to just go on and book themselves.
Thanks, Steve. And then finally, Jason from the Mail.
Thanks. You seem to be telling us that after a summer off, we need to start concentrating on this again. Are you saying that, in broad terms, that if we don't get our boosters, if we don't take a bit more care over who we see indoors this winter, we are more likely to face restrictions in the next few months? Dr. Harris, you've talked about immunity waning. I don't think it's well understood. If somebody is, say, 80 years old and they had their AstraZeneca jab in January, how much has it waned by now? And just finally, the White House has said today they're going to start jabbing children as young as 5. Could we do that here?
Okay, thank you. Look, I think everyone understands that in the summer, it's less attractive conditions for whether it's COVID or flu. We could be outdoors more. It doesn't like the warm weather and things, and that's one of the things that clearly helped us during the summer, alongside the vaccinations and some of the other things we've been talking about a moment ago. The winter we've always made it clear it is a more challenging period. It is normally with other viruses. So even remember the pre-COVID days, it might be hard to remember them now, but for those of us that do, that whether it's flu, norovirus and others, they love the winter. For these kind of viruses, they love that kind of weather. And so we expected it to be more challenging as we head into the winter. That's why we set out the plan around the NHS, our social care system, and all the extra support, more than normal, that they'd get over winter. But to answer your question, very specifically, Jason, that you said, am I saying that if we don't do our bit, get vaccinated, all those behavioural changes that we can make, that we are more likely to face restrictions as we head into winter, then I am saying that. I think we've been really clear that we've all got a role to play. If not enough people get their booster jabs, if not enough of those people that were eligible for the original offer, the 5 million I've talked about, that remain unvaccinated, if they don't come forward, if people don't wear masks when they really should in a really crowded place with lots of people that they don't normally hang out with, if they're not washing their hands and stuff, it's going to hit us all. And it would, of course, make it more likely we're going to have more restrictions. Now, we want to avoid those. We've set out what those restrictions might look like. We've set out the Plan B restrictions, for example. And we all want to avoid those. So we've all got our role to play. We can do it, because we've already done it. That's the good thing. We know what to do and how to do it. We've just got to play our part. And so if you're invited for a vaccination, then please take it up. Please, please. We've got plenty of vaccines, and we just need people to come forward and play their part to help us to keep defeating this virus and going ahead and getting more and more back to normal each day. I think I will leave it there.
There were a couple. Shall I just answer?
On the child vaccination question. Do you want to answer that?
And I think vaccine effectiveness, wasn't it, on waning? Yeah. So I think an important point for people to think about is whether the data that they hear is about getting an infection, which may not be significant, and serious disease, hospitalisation and death. And obviously what we've seen is the effectiveness of vaccines doing that, and they continue to do that. So obviously an 80-year-old, a 65-year-old will have different underlying conditions, but for somebody over 65 who's had an AstraZeneca vaccine, has had 2 doses, our current evidence suggests that just under 80% vaccine effectiveness in protecting against hospitalisation. That is a brilliant vaccine. If we have that for all of the vaccines that we use, that's very, very good. So I think there's a key message there. That's at 5 months. Now, that doesn't mean that we're not seeing some drop-off in that as we go forward, which is exactly why we have the vaccine booster programme put in. But people shouldn't think that their coverage, if you like, from that, their protection suddenly goes over a cliff edge at 5 months and 1 day or 6 months and 1 day. It doesn't, but it will wane, and the booster will actually boost people relatively quickly compared to a first dose. In relation to children, obviously, those questions go to JCVI. They look at all different age groups all the time. Transmission from younger children has been considerably less, and what we'll have seen in recent weeks, obviously, is the 11 to 14-year-olds, the young teenage group, that's the predominant one. So the balance of risk and benefit will be different for younger children, and that's what JCVI look at.
Yeah, thank you, Jenny. Look, I was told not to take any more questions, but I will ignore that advice that I had and take one more.
Well, that's really kind. Guardian,
2 more, then Sebastian. That's it. Please.
Can I just ask that a lot of this press conference has been couched in terms of it's up to the public to come forward for jabs, but immune-compromised groups have been saying that people who really, really want their 3rd jab, not the booster jab, a 3rd jab, only 40% of them have even had the invite to actually get them. You've got people with blood cancer turning up at drop-in vaccination centres, basically begging to get a 3rd jab. And a lot of people who've got kids in school, over 12, are saying that they really, really want their kids to get a jab, but the jabs are simply not there. And at the same time, the JCVI has yet to decide whether or not 16 or 17-year-olds are going to get a 2nd jab. And this is nearly 12 weeks after the 1st jabs. Is there also more the government could be doing?
There is, yes, and we are doing more, and set some of those actions out today. So, for example, you mentioned access for children. And that's why we're standing up the vaccination centres during half-term and beyond half-term, actually, to give parents more choice. There's always more that we can do. Of course there is. There's a lot for the government to do. We've got to keep playing our part, whether it's the central government, it's the NHS and others, and we will absolutely do that, always looking to see how we can improve access, for example, to vaccines in particular. You've also mentioned another really important point, which is the immunocompromised. And people will know that a few weeks back, under advice of JCVI, that there was a recommendation that all those that are immunocompromised, that they get access to or given a third dose. So I want to distinguish that between a booster dose. It is a third dose, but it's properly a third dose rather than a boost. And eligible people have been contacted and are still being contacted either by their GP, their consultant, their hospital. There are some people, by the way, that are immunocompromised, but they might not be eligible at this point, and that might be because of the treatment that they're receiving. So the treatment for any particular condition that they might have, for example, a cancer condition, that you have to wait really for the advice of your clinician to see when's the right time to get it. So there are some people that are waiting, but that's because of the advice of their clinician. The other thing I think is, again, it's worth highlighting is the news that we've announced today is really relevant to immunocompromised, and that is the new treatments. The new treatments, the 2 new antivirals that we're one of the few countries in the world that have procured them. As soon as we get approval from MHRA for those, we'll be able to deploy them on the priority groups, those that are most at risk, and that, of course, your top of that list are going to be people that are immunocompromised. So it really gives us a new tool to help and treat, but especially those that couldn't benefit from the vaccine protection itself, and it gives a new way to try and help. And then final question, Sebastian.
Thank you very much, and thank you for the question. Mr. Javid, is there a difference here between what you're telling people to do and the behaviour of some senior public figures? For example, Professor Powers just said we should be in a situation of wearing masks in tight indoor spaces to ensure there is ventilation. In the House of Commons today, the benches were completely packed. Nobody on the Conservative side was wearing a mask. And one of your ministerial colleagues said that he was planning a Christmas party, which seems to go against the kind of advice we're being given. So isn't there a slight difference between your telling the public to do one thing and acting differently yourselves?
I think Seb, that is a very fair point, and think that we, as I say, we've all got our role to play in this, and we, the people standing up on the stage, we play our sort of, let's say, our public roles, and as a Secretary of State, as someone in the NHS, as the head of UXA, we've got big roles to play, but we also have a role to play and set an example as private individuals as well. I think that's a very fair point, and I'm sure a lot of people would have heard you. Thank you all very much. Thank you.
There we are. That's Sajid Javid's first Downing Street press conference, certainly COVID press conference. This pandemic is not over, he said. The vaccine has weakened the link between cases and hospital admissions and deaths, but not broken it. There's still a threat. But the government, he said, and here's the point, would not be implementing Plan B at this point, he said. But he warned cases could go as high as 100,000 a day. And he said we'd do what it takes to protect the NHS from being overwhelmed. Jenny Harries of the UK Health Security Agency said the numbers are going in the wrong direction. Stephen Powis of the NHS said the NHS is under considerable pressure. Interestingly, Sajid Javid said we don't think the pressures on the NHS are unsustainable. And it was really a call to the public to play its part, the over 50s to get booster jabs. And he said if we play our part, we can give ourselves the best possible chance of getting through the winter and enjoying Christmas with our loved ones. Let's bring in our political editor, Beth Rigby. And Beth, I mean, basically, that was the point, wasn't it? Saying to the public, if you do the right thing, you can enjoy Christmas. It's down to you. If you don't, then we could get more restrictive measures.
Yes, Mark, that was the first COVID press conference since September the 14th, 5 weeks ago, when the Prime Minister announced that winter plan, that Plan B, if necessary, and then the fears over COVID, if you like, dropped away. It wasn't discussed. There hasn't been face mask wearing in the Commons, particularly, for example. There hasn't been any mandatory face mask wearing at all. There hasn't been any requirements for social distancing. All of those rules and that guidance that we live for and by for so long had fallen away. And I think really my takeaway from that press conference is COVID is back. It is a risk. It's a growing risk. The government are clearly worried about it. The NHS are talking about rising cases, rising admissions. And I really think that the message there from the Secretary of State, and he said it a number of times, was that not at this time are we going to implement Plan B, but everyone needs to do, and I quote him, their bit to prevent that from happening. He said quite clearly in that press conference, you need to go and get jabbed, not just to save lives, but, and I quote him, to protect our freedoms. Jason Groves from the Daily Mail, the political editor, explicitly asked there, if we don't get our boosters, if we don't follow some of your recommendations, does that mean that we're going to have to face further restrictions? And the Health Secretary there was quite clear when he said, yes, you are. Everyone needs to do their bit. Otherwise, further restrictions are coming down the line. And it was interesting that they dusted off some of the old guidance and rules. So suddenly we're being asked again to think about meeting outside. We're being asked to put on face masks at our discretion when we're in crowded or not ventilated areas. And then also there was a big play there in a press from him about lateral flow testing. Take a lateral flow test before you're going to your Christmas party, for example. Take a lateral flow test before you're going to meet people. Stephen Power said if you've got a cold, a virus, think about not meeting people. So what the government are doing really is they're trying to push the responsibility back on to the individual, to ask all of us to make these minor micro decisions in our lives. The first and foremost being get the vaccination, get the boosters if you haven't. But the warning there is quite clear that if the case numbers keep going up and the hospitalisations rise, then Plan B will be enacted, and we're going to have a far more restrictive regime again in how we live.
OK, Beth, thank you very much indeed. Well, in a moment, I'm going to be talking to the Shadow Health Secretary, Jonathan Ashworth. But first, let's hear some of what the Health Secretary, Sajid Javid, had to say about the threat facing us as we head into winter.
Cases are rising. And yesterday, we reported 43,738 new cases across the UK, up 16% from the previous week. And they could go yet as high as 100,000 a day. We're also seeing greater pressure on the NHS. Across the UK, we're now approaching 1,000 hospitalisations per day. The NHS is performing with distinction, and I'd like to thank everyone who's working so hard to keep us safe. And we'll do what it takes to make sure that this pressure doesn't become unsustainable and that we don't allow the NHS to become overwhelmed. Deaths remain mercifully low, but they are still, sadly, over 100 a day. This pandemic is not over. Thanks to the vaccination programme, yes, the link between cases and hospitalisations and deaths has significantly weakened, but it's not broken. So we must all remember that this virus will be with us for the long term and that it remains a threat to our loved ones and a threat to the progress that we've made in getting our nation closer to normal life. We're looking closely at the data, and we won't be implementing our Plan B of contingency measures at this point. But we'll be staying vigilant, preparing for all eventualities, while strengthening our vital defences that can help us fight back against this virus. I'm pleased to announce that we have signed 2 landmark deals, securing hundreds of thousands of doses of 2 new antivirals from Pfizer and from Merck Sharp Dome. These antivirals have the potential to speed up recovery time and to stop infections from progressing. If these treatments get MHRA approval, then we can provide some of the most vulnerable patients with vital protection this summer. And I want to deploy them as quickly as possible.
Sajid Javid there. As I said, I'm joined now by the Shadow Health Secretary, Jonathan Ashworth. Thank you for being with us. So what did you make of what the Health Secretary had to say?
I thought it was a rather complacent presentation, frankly. Look, we're in a very serious situation now with the levels of COVID infections in the community, which is obviously knocking on to hospitalisations and sadly deaths. Government ministers have talked about our wall of defence being vaccination. Well, our wall of defence is beginning to crumble because the booster programme is stalling. On current trends, we won't complete that programme until spring of next year. That's simply unacceptable. We've only vaccinated around 15% of our young people, and of course the infections are concentrated at the moment in school children. I think over the last 3 weeks we've seen around 10,000 infections a day amongst children. Of course, the third doses for the immunosuppressed is stalling, and charities have called it chaotic. And the flu vaccine, which we also need to really ramp up, is running at around 36% for over 65s. I wanted to hear from ministers how they were going to get a grip of this stalling vaccination programme.
Well, to be fair, they have said...
to ramp up vaccination.
To be fair, he said they were going to accelerate the booster programme for the elderly and the vulnerable. I mean, what would Labour be doing that the government isn't? Sort of rushing to another lockdown?
Most certainly not. Nobody wants to go back to the dark days of lockdowns, and nor do we want to see the Prime Minister impose lockdowns on places like Bolton, Burnley, Bury and Leicester, my own, which he did in the